So I just wanted to say thanks to everybody for coming to the third webinar in the HDR UK Wales programme. And today we're going to be looking at co-production of linked data research. So bringing together health and administrative data and how co-production is done in this field. So I believe Jack's going to talk more on the how, and May and Georgina are going to talk about a case example of that. So I'll just pass over now to the team. Thanks very much. Sorry, Jack is the co-production officer in HDR UK Wales, and May is in Bangor University. Um, um, working on like the PPI lead on many projects.
Yeah, thanks very much. My name's Jack, as Sinead was saying. I'm co-production officer based in Swansea University as part of HDR Wales UK. Today we're going to be talking a little bit about, as the title suggests, PPI, co-production, engagement, all of these things in the context of health data research. I'm going to go through some of the principles and I guess an overview of those things, and then I'm going to hand over to my colleagues May and Georgina, who both work together on a real life project to give a case study. So I'll try and get through my bit pretty sharpish. So we've got plenty of time to go through that and have some questions at the end. A little bit then about, I guess, why this is important. Really doing engagement, involvement, public involvement enhances the value, the quality, the ethics of the research we do. It helps bridge the gap between society and research as well, by making us focus on real world scenarios and things that actually are relevant to people. That means that the outputs of what we do hopefully have a real impact. If none of that motivates you, it's also increasingly highly requested by research funders. I think recently the NIHR have said that that's become a mandatory part of funding applications. So, this is a growing field. So it's really important that we give it serious attention. So without further ado, I thought I'd just start by talking a little bit about some of the definitions which float around. A lot of different words like engagement, involvement, collaboration, co-production kind of appear on applications or on reports, and sometimes people have got different definitions of what they mean. I mean, a good example is, do we say PPI, PPIE, or PI? I've seen all of those at various times when you're looking at these kind of discussions. So it's important to say all of these things are valid. They're all accurate, but they are distinct from each other. They've all got different meanings. So I thought I'd just start by talking through some of those definitions. Engagement is where information and knowledge about research is provided or disseminated. So examples of this could be science festivals, research open days, awareness raising, doing things in the media like a press release, and your kind of standard or traditional dissemination stuff like conferences. Whereas participation is where people might be taking part in your research study. This could be a clinical trial, could be people doing a survey, attending a focus group. You're getting something from them to contribute to your research. Whereas involvement is when people are more actively involved in developing or actually shaping how the research looks. So this might be identifying research priorities, could be appearing as joint grant holders or co-applicants, could be commenting on and developing how you're going to do public involvement. So you might have some people working with you to design that, or actually delivering the research with you. So that could be like undertaking interviews or shaping the dissemination, which we'll talk a lot more about that later on this webinar. Just a note about public partners, that's kind of what I prefer to term the people that we work with. It's used by the NIHR as well as a definition. So this could mean anybody who's impacted by the research or who is relevant to the research. This could be relevant charities, could be interest groups, could be members of the community, carers, people who obviously have got a disease or a condition, somebody who uses a service, anybody who's directly associating with it is important to work with. So there's one definition I'd left out there, which is co-production. You can see the quote on screen saying that in particular it centers around sharing power and responsibility, which I think is kind of the most important bit of co-production. You can think about it as well with this handy diagram. So on the left there, when citizens might be working together to make change, that's usually seen as like community-led action where they're lobbying somebody, or when professionals or organizations are working together, say researchers between different universities, that's collaboration. But it's only when you've got citizens and professionals working together in equal partnership where you could really call that co-production. If it's not that, then it's something else. It's involvement or it's participation. So again, not saying that anything's better than something else, but they are different. A different way to look at co-production, which I quite like, is a definition by an organization called Of, By, For All, which I'm quite fond of. People doing research are typically in it for the right reasons. We always say that we're for our community. We're trying to improve something. We're trying to make people's lives better, but we're not always maybe doing that with people. So if you're doing it in communication, in complete isolation to the community, it's a bit like trying to organize a surprise party for somebody, except they don't know anything about it and you're trying to plan it on your own. So I might be well-meaning, but if I chose the food and the music based on what I think is best and only invited my friends, it's not going to be a very good party for that person. But what would happen if I spoke to that person's family about what they like and got their friends involved in planning and hosting the party? You get a totally different result and hopefully far more successful. So to give it more of our world example, if you want to be for your community, if you want your research to be relevant and empowering for that community, then you need to make sure that your research priorities, maybe the teams, the partners you work with, are representative of that community. And then the research you do is co-designed, co-delivered, hopefully co-evaluated by that community. And then you're doing something that's for the community. So yeah, it's a formula which I never thought I'd be talking about because I'm not a data scientist, but I think it's quite a powerful one. So just to summarize some of those key principles of co-production, then the sharing of power is kind of the key principle for that. Really is what everything else leads on from. Having a shared responsibility rather than having a space that researchers have got all the power and people are kept at arm's length is really important to achieving like a joint understanding. Similar to that, including all perspectives and skills and recognizing the expertise that people have got, whether that's through their lived experience or through a different calling, is really important. And then following on from that, respecting and valuing that knowledge. So seeing it as equally important, whether that's somebody who's got technical skills on a project or whether they're bringing their experience of something. Having mutual benefits is really important. So you're not just taking from somebody, you're talking about how can people get something back from contributing to the project. So we talk a lot in research about compensation, things like vouchers and payment for time, but just as important can sometimes be around building confidence, being empowered, learning new skills. So there's definitely something to work on around that. And that kind of, again, leads into the last point there around maintaining relationships. So what you're doing shouldn't just be a one-off relationship. It should be a long-lasting, mutually beneficial relationship where you're becoming stronger and you're working on more things into the future. That's how you kind of build trust with the community. One way to look at all of these things together, people might have heard before about the ladder of participation, which was based on a researcher called Shelley Arnstein in 1969. The diagram on screen now is something that the Co-Production Network for Wales have done, where it's put on its side as more of a spectrum. That's quite important because we're not saying that some things are bad or some things are better than others, but it is important to notice the difference between them. So you've got kind of down the far left there of doing two, where researchers may be trying to educate or just give something to people. So that's maybe we're seeing ourselves as part of a all-knowing institution. Doing four begins to move more towards having the right intentions, like we just talked about, but you might just be consulting people. So what you do is informed by people, moving in then to asking people to influence your research to help design it with you. And lastly, then doing with, where you're maybe co-producing with people, they're actually involved in delivering or evaluating the research with you. And when it's not an exact science how you define these things, but I'd say that engagement kind of fits more with these things around educating people or consulting them or having them as they're giving something to you, whereas then involving people moves more into where they're influencing and shaping or hopefully co-delivering with you what you do. It's important to think about every project being different, depending on the stage you're at or the problems you're tackling. Co-production isn't always the best option. It's not always possible. So it's important to think about what kind of different problems there might be. So this is something called complexity theory, which is a lot more scary than it sounds. It's just thinking about what sort of issue there is that you want to challenge. So baking a cake, for example, is a simple problem. For this, you don't need to have a lot of training. There's quite a predictable method. What you do, if you're following a recipe or a process, you're going to get quite a predictable result, and it's something that's quite linear, can be repeated. So for a simple issue, you might just work with people. A complicated problem, though, might be something like building a space rocket, where it can be solved in a predictable way, but you need expertise and people with specialist training or knowledge to bring to the problem. So that's where you might want to call in the specialists. Then you have something called complex problems. If you haven't guessed already, a complex problem might be something like, for example, raising a child. There are thousands of books written on how to raise a child. Not one of them is the complete authority on that. No matter what you try, no matter how you do it, if there's any parents on the call, you're going to get a different result every single time, and you can't predict how those kids are going to grow up. So that's kind of what this sort of problem is like. So I guess other real world examples of complex problems could be more messy societal issues. So it could be things like poverty, substance abuse, violence. These are difficult issues where there's no predictable outcome. There's no one way of tackling those problems. So here is where something like co-production is the best way to solve that problem. Because you're bringing people in with a diverse range of experiences and knowledge, and you've got the best chance of addressing those issues. So just something to think about, like what sort of problem are you trying to tackle? In terms of what good practice looks like when we talk about public involvement, there is a UK standards for public involvement, which is really good to try and tie your work to. They were developed over 3 years by a UK-wide partnership, and they're for anybody who's doing health research or social care research. So really useful to look at. And yeah, they kind of highlight what some of the key things are, which I'll break down a little bit now in a bit more detail. So I won't read all the stuff on screen because I'm conscious of time, but this theme around communications encourages you to consider how you talk about your research. Are you listening to your partners? Are you sharing your learnings in a way that's going to have impact? Working together, as it says in the tin, it's about being better when you're working in partnership with people towards a common purpose, and you're respecting the different perspectives that people might bring, their expertise, like we were just talking about. So, for example, this could be jointly agreeing clear roles and responsibilities in an early stage. It could be about giving partners an active role in the project and considering how power relationships kind of work then when you've got your project governance. Are you keeping people at arm's length from decision making, or are you inviting them to be equal partners in that? Inclusive opportunities. This is about removing barriers to participation, being accessible, maybe flexible in how you work. For example, are you asking to meet at a time or a place or in a way which doesn't work for the people you're hoping to partner with? Just being a bit mindful about how you're going to work with people. I touched on governance, but public involvement in governance is really key for transparency and trust in what we do. For example, like, are your public partners involved in significant decision making about the research, or are they kept at arm's length? So about having a really robust way for people to shape what you're doing, not just in trivial ways. Support and learning. This is about the importance of building confidence and skills for public involvement in research. Does your research grow capacity for the individuals or the groups you're working with, so they're better able to engage in future research? Are they learning some skills? Are there any skills which member of the project team as well? So the people who are the researchers that they need to do this, because this isn't always, the easiest thing to do. So actually not just assuming that you can do it straight away. Is there any sort of training that would be good to do? And lastly, I believe impact. Again, as it says in the tin, you should seek improvement by identifying and sharing the difference that public involvement can make to research. So what are the changes that involvement's made to your decision making, to the way your research is looking, and to hopefully then the experience of the people who are taking part in it as well. So really important to record that, and we'll talk a bit about that in a minute. I know I'm rattling through, and we talked a little bit about the kinds of problems that you're addressing, but people often ask, like, when is a good time to start? The answer is anytime. Research isn't a linear one-off project with a set timeline. It often feels a bit like a cycle where you're always working towards the next thing. So seeing it as this sort of diagram on screen suggests, as a circle that you're constantly working through, is a really nice way to approach this. I think telling people about your research is important. I think people often talk about PPI as something that you do either right at the start or right at the end of a project. like dissemination, but you need to do more than that to really keep people involved in a meaningful way. So looking at some of the examples on screen, you might have to squint a little bit, but each of these sort of stages of a typical project, there are opportunities for people to be involved, whether that's to participate in something, to be involved in shaping something. There might be opportunities to co-produce, to co-design or co-deliver something. But depending on the nature of what you do, there's always an opportunity for involving people in the cycle of research, and that's increasingly important, I think, with funders' expectations that it's not seen as a tick box exercise where it's okay, we'll speak to some people at the end of our research and we've got away and done it all ourselves. No, it's something where people can be involved before you even start an application, during the bids, during the delivery and the design. So just a really useful thing to consider. Another question we get a lot is about who should you be working with, what the kind of communities that might be there to reach. Sometimes it's a really obvious thing, but it's not always. It's good not to kind of talk about the community in a way that feels vague and a bit kind of tokenistic. So here are some kind of examples of different groupings of people that you might come across. So you can have communities of interest, so people who might share a common social identity or a passion in something. You might have communities of practice, so people who share a similar craft or discipline or profession. The most easy, I guess, to identify might be communities of place, so people who are sharing a geography, a particular area, neighborhood. You can also have communities of action, so people who are impassioned about a particular issue or a thing they're trying to make change on, which is a really good way to bring people together. Lastly, you could have, say, communities of circumstance, so people who might share a common identity or a life situation, something that might have happened to them. So in the context of health research, that could be people who have got the same condition. While I said all that, I don't want to completely undermine it, but please be aware all human beings are unique. We're all characterized by a multitude of factors, such as the ones you can see on screen. So they will all shape our experiences, our outlook on the world, our opinions. So something which I always try and underline, it's really important when you're working with PPI members, particularly if they are meant to be kind of representing a group or a cohort of people, not to treat them as spokespeople. I prefer to say they're advocates, that they can advocate for their experiences or maybe for some of the experiences they share with other people, but they are still individuals. So don't kind of put that pressure on people. I think a nice analogy might be that you wouldn't use a small amount of data to draw big conclusions, so don't do the same thing when you're undertaking PPI work. Lastly, before I hand over, just wanted to talk a little bit about ways of actually recording this, because again, I think people ask about that. The Pirate Impact Toolkit, which you can see on screen there, it's a really useful tool for planning your public involvement, but also for recording it. It was co-developed with public contributions by a team based at the Marie Curie Research Centre and the Wales Cancer Research Centre, but it's been made freely available for anybody to use. It's got two parts. There's a planning tool, which looks a little bit like this. This is just one section from it, but kind of reflecting on some of the things which I've just been talking through. These are some kind of, I guess, proactive questions just to ask yourself when you're planning your research. For example, are public contributors going to be involved in developing the study outcomes? Just which I think is section D there. It covers how, I guess, you could shape an application. You might notice as well that lower down underneath each of those, you can see it's noting which of the UK standards for public involvement it's addressing. So those standards we were just going through, I guess it's a way of not just sort of blithely saying on an application, oh yeah, we're doing everything in line with the UK standards for public involvement. You can actually demonstrate in a really clear way, okay, these are the ones which we're addressing. This is how we're manifesting this in our work. So again, just a really nice, clear way of doing it. The second part of the tool is a record. So it's literally just like an Excel spreadsheet, but you've got these columns. So it's a really handy way of recording who you spoke to, when you spoke to them, what was said, and what's the impact been on your research. So that last bit is the really important bit. It's not enough just to say in a kind of vague way, oh, we've consulted with charities or we've engaged with groups. You need to be able to say, well, what was said, and most importantly, did you actually listen to it? Were you able to take those things on? And I think sometimes researchers shy away from that because they can feel like they might be backed into a corner. There might be feedback telling them to do something which isn't feasible. That's okay if that's happened. I think it's just important to, if you can't do something, you need to explain why. So it's adopt or explain. And that's not just for the funders or the people who might be looking at this. It's also important for the people who you're involving, your partners, because if you're given feedback by somebody and you don't implement it, well, that's a really easy way to lose trust or to switch people off from working with you. So I think it's good sometimes to kind of have these records and actually share them with the people you're working with, so they can see what you've recorded as well. So you're not just marking your own homework. They can say, okay, yeah, that is reflective of what I've said. And on this spreadsheet, by the way, it does track across to this is sort of on the right hand side if you can picture that. But again, what you're doing, you can link to the UK standards for public involvement and say, okay, well, which of these things am I addressing here? Which of these things am I doing in my activities? So really useful tool to kind of co-own and keep a record of what you've done. Thinking of that research cycle we looked at a minute ago, the so if I go back to it, the circle. Please, for the love of God, do not record all of your PPI work right at the end when you're scratching back through emails and trying to remember when you spoke to people, what was said. If possible, as soon as you can, just download one of those and start recording. Any early conversations are great to record, and then everything as you go through that research cycle. There's no harm in doing it, and it can be a really big, comprehensive record of everything you've done then towards the end. So yeah, really useful. So as promised, I have kind of deliberately rattled through that a little bit because I want to give plenty of time to May and Georgina to talk through their case study. So this is, oh, I'm going to, there we go, sorry, little microphone issues there. Yeah, this is a case study about Champion Project, which May was one of the lead researchers on, and Georgina was a public contributor on that project, so somebody with lived experience. So they're going to tell the story of this, but also focus on, I guess, the PPI elements of what works, what were some of the things they do, because also I'm aware sometimes these presentations, people might think, well, that was all great in principle, but how do we actually do it? What are some clear examples? So that's what we're going to do today. So yeah, I'll hand over to you, May.
Thank you so much, Jack. That was such a good foundation to start this. I think Georgina is having some problems with her computer, so just gonna go ahead, and when she joins us, she can.
I am here.
Oh, you're here. Amazing.
Resetting,
Fantastic.
so I'm currently on my phone. I apologize for that.
No problem at all. Please don't worry. So I'm just going to introduce myself again. I'm May. I'm the PPI lead for the Center of Population Health. I was the research officer in this work I'm going to be talking about today. Georgina was one of the members of the public on it. This is available, so I believe it's open access. It's on the Cochrane Library if you're curious, you want to learn more about it. And I'll let Georgina introduce herself now.
Hi, I'm Georgina. I'm a PPI member and I have chronic pain, which is why I was involved in the Champion Project.
So the reason we've done this study is because we wanted to understand how young people who have chronic pain and their families, how they think about pain, how they experience live with pain, how they experience going through the social care and services, and what do they want from the services. So basically what we wanted to do is really to develop a theory or a way to better manage their pain based on their experiences. And this being developed, and I'm happy to say that it's now being used by the new chronic pain service in Cardiff, which is very exciting to see. And this would be a completely different work if we didn't have our members of the public. So a huge thank you to them and Georgina, who is here today. So we had, in addition to our PPI group, we also had an advisory group, which were constituted by healthcare professionals, but we worked more closely with our members of the public. They had a key role in the study. As you can see, so we had 12 children, young people, and they had a huge difference in age, so broad age ranges, from 8-year-old to 20 years old. We also had parents, so 8 mothers of children with chronic pain, so they're all mothers, and they're based across the UK, so England, Scotland, and Wales.
So the most effective PPI usage that I've been involved in has been throughout the entire project. So starting right at the beginning with writing a research proposal all the way through to dissemination. For the Champion project, before we were even funded as PPI, we helped define the aims and objectives and focused on what we thought would be most useful, which actually shifted the direction of the study.
And as you can see here, what we've done is called a methodology. You absolutely don't need to know what that is, but it's a quite complex study. So it has 7 phases. And when we planned the study with our members of the public, we really wanted to include them at each one of the stages that you can see here. We're going to talk through each one of those stages now, but as you can see here, we had planned with them and decided how we would include them. And the first thing we done was trying to understand, as Jack mentioned before, we use the UK Standards for Public Involvement. And one of the very important things is to understand training needs. And as you know, as I mentioned before, we had a broad age range. So we're working with very different ages there. And so what we done was to create online surveys that were specific for different ages. So we had one for the youngest ones, one for our teenagers, and one for the adults, so the mothers. And that worked really well. So we tried to make it very visual for the younger ones. And the way we developed the online training was really, those surveys were based on what do you want to learn? So we don't assume they need to learn something. We ask them, what do you want to learn? Is there any skills you think you need or things you want to develop? Because this is a two-way relationship. We are learning with them from their lived experience, and they're also learning with us during the, about research. So the things they came up with was they really wanted to learn about research. So what is research? What is a methodology? Define research and how to use Zoom. So we had training was delivered in a flexible way. So we used drop-in sessions where they can just pop in and learn about different things, especially how to use Zoom. And other things were inbuilt into our workshops.
So we were sent all the resources in advance of the actual meetings. So with agendas, any updates, things like that, which meant that we could prepare beforehand and have any questions or answers ready if we wanted to, but there wasn't any pressure to do so. And it really helped the meetings run a lot more smoothly. So as you can see, we had icebreakers, which might seem a bit awkward, but actually it really helped us all to get comfortable with each other. They were just silly things like, what superpower would you have? But talking and laughing about something like that made us all a lot more comfortable with each other, especially sharing quite personal experiences and things like not being listened to by doctors. So we were updated at each one on what stage of the project we were at, and the researchers used some infographics to show us how they'd been doing. And we all really appreciated that at every stage we were kept informed of what was going on. We were asked our thoughts and views on what had been done, and also asked how our experiences were similar to or differed from the findings. And it was really useful for us to clarify things and give the researchers some insight into things behind the findings, because they're things that researchers wouldn't necessarily know, but as people with chronic pain, we did. A standard phrase I hear in PPI meetings a lot is, you are the experts, which is always a really lovely way to acknowledge our experiences and show us that they're going to listen to us.
So here's an example of the ground rules. It's important to say that this was one of the first things we had at every workshop we done, like Georgina said. And this was developed by everyone. So we created this together, and at every workshop we would go back to it, revise it, make sure everyone was happy with it, if they wanted to add anything or change anything. So this is a really good place to start. So it's important to remember we're asking people to share very personal, very difficult things that might bring some difficult feelings, difficult memories. So it's important to make sure the environment you're developing You need to create a safe environment. So that's one of the most important things, I would say. People need to feel safe, and they need to feel that they have the trust. So you need to build trust. So that's very important. So that's one of the ways we try to do that. One of the challenges we had with this specific project is all the planning was done before the pandemic, and we had to change everything to online and really rethink how we're going to do things. We wanted it to be engaging. We are working with young people. We want them to enjoy, even though we're discussing very difficult things. So one of the things we came up with was to use cartoons, especially to involve them in the analysis stage, which is a very difficult stage, which can be quite boring, to be honest, for young people, especially if you're talking through different findings. So a cartoon is a way we found to make it a bit more engaging, and also to make it something that could look like from the distance. So they're looking at different scenarios. We created different scenarios. So that helped them to look at the cartoons, the scenarios, relate to that, but be able to express their opinions on something that was almost like detached from them. We used speech bubbles with the language we found from the actual papers, or we asked children we knew, like members of the team had children, and they asked what kind of language they use. We wanted to make sure we got the language right, that the language was appropriate, was engaging. And we also made sure to ask open-ended questions. So in a way that we didn't want to lead anything, we want them to be able to express themselves and just share their thoughts without us having any input on it. And I'll give you an example, and Georgina will talk through another example, but one of the findings we had is that in chronic pain, there's a lot of mental health problems that come with it, because I'm not going to go into it. I can get really passionate and just start talking about it. But one of the things we found is that when young people are offered psychotherapy, there's a huge stigma, the families, the way they view that. And we wanted to express it really well, because it's a very sensitive problem. And the way we came up with was this cartoon. So that's basically a scenario we created based on the finding we wanted to discuss with our members. And it's just basically the title just says everything. So attitudes to being offered psychological treatment. And it's basically a little description saying that many families don't know why they're being offered psychological help. And sometimes they can, especially the parents, we found they can feel blamed, as if the problems was something they done, or the child might think, oh, is everything, do they think the pain is in my head? No, my pain is very real. So this is just set the tone and help us to discuss. And I'm not gonna, don't want to say too much, because I want Georgina to have time to say about her experiences with the cartoon. But one of the things we tried to be very careful with was also the scenarios we created. We tried to be representative. So there's a lot of thinking that went into it.
So we got the cartoons in advance, like we did with everything else. And I think it was a really engaging way of getting us all to view them. Even me, I was one of the older participants at the time, and it was a really fun way to get involved with it. And yeah, we were able to clarify a lot actually from the cartoons, because I think we had something like 10 cartoons or something. And in each one, we were really able to show our thinking behind it as people with chronic pain, or from the parents' perspective. So here's one of the other cartoons we were shown, and we were able to clarify the difference that we have between control, because there's a difference for us between being in control and being resigned to being in pain.
And here's an example of the infographic. Georgina mentioned that one of the ways we kept people updated, our members updated, was using visual ways. And this infographic was a work in progress. When we started, it was just the top area that you can see there, over here. And as the project developed, I started adding things. So this is much nicer than just sending a huge text to let people know that's how many papers we looked at, that's how many studies we looked at. So here they can see it visually. So it's just a nice touch, and especially for the younger people, they feel a bit more connected. They feel like an effort was made, to keep them updated in something they can just visually look and get all the information they need. I will just speak briefly about dissemination. Georgina will have a lot more to say about that, because one of the things we wanted to make sure we got our dissemination right. And we asked Georgina if she would be happy to be your champion star and really lead the dissemination strategy. So we came up with things, well, when I say we, the researchers and the PPI members, so things that would reach their communities, such as a video animation we co-produced together, podcasts that Georgina was part of. We also co-presented the conferences, we had the social media, and they also had input on our scientific outputs. And I'll let Georgina now she will have much better things to say about it.
Like May said, I was very involved in the dissemination for the Champion project. So by then we'd been working on the project for a few years, and it was really exciting to see it all come together. So one of the main outputs for us as PPI members was we co-produced a video animation called the Chronic Pain Roller Coaster. And so that dictated things that could happen on a child's chronic pain journey. I took part in a podcast. I was asked for quotes for articles on the Champion project. I took over the social media channels to talk on Champion, and then I also went to Wales to actually present at the Royal College of Nursing, which was just amazing for me. And the key thing in all the dissemination was I was able to share it on all of my social media. And the thing with my social media is a lot of people with medical conditions are in Facebook groups specifically for their conditions. Is it working? Sorry, my audio has gone a bit funny. There we go. Brilliant. Thank you. And so, yeah, a lot of people with health conditions are in Facebook groups, especially specifically aimed at their health conditions. So things like Crohn's disease, and then also different demographics like wheelchair users. And on these social media groups, pages and researchers often aren't welcome at all. You need to have the condition to join, and it's really restricted what outside content you're allowed to share. And each group also has different rules about posting. But being someone who has chronic pain, I'm part of a load of chronic pain groups on Facebook. So I was able to share the research in all of them, and everyone was really receptive to it. And because I'm a member of the groups anyway, I was able to reach this new demographic that the researchers wouldn't have been able to otherwise. We got really positive feedback from it, which was amazing, especially the chronic pain roller coaster. So many people saying it had been really beneficial to show their children, which was wonderful to hear. And because of sharing in social media, I always encourage researchers to make a plain English infographic so that we as PPI members are able to distribute it to our networks, which can just reach so many more of the people that the research will actually affect.
Thank you, Georgina. You explained that much better than I could. So that's the chronic pain roller coaster that Georgina just mentioned. So that was animated cartoon, and we developed this with our members of the public. So it was completely co-produced. We really wanted them to say what kind of findings should be there, how it would look like, everything, what kind of voice actors they would like. So it was their product, I would say, their output. They created and developed this. So I think I'll let Georgina again talk a bit more about her experience with this, because I'm sure you again explain much better than I could.
This was one of the best parts of the Champion project for me. It's seeing all of our findings come together and getting to put them into something that it just looked so amazing. It really did. And getting to share that with people was just wonderful. And we really wanted the cartoon to be very inclusive. So we had people of sort of all demographics in there. And we also wanted to make sure we represented a wide range of disabilities. So throughout the cartoon, there's people using things like different mobility aids and things like that. And we also needed to make sure all of the materials were accessible. So I wrote subtitles for the video and also a video description that was for people with visual impairment so that they could have audio readers read it aloud and they could also access it.
Thank you, Georgina. I just forgot to say the QR code there will bring you to the cartoon if you want to watch it. So if you have any feedback for us, feel free to get in touch as well.
It's really difficult for me to find a single negative with what happened in the Champion project. I was involved at every stage and kept informed and up to date throughout. And because we could see the difference we were actually making at each stage in the project, it really felt like I was making a real difference. There were a lot of barriers that happened because of health conditions and things like that with us being patient and public members that the team overcame really well. So one of them being travel. All of our meetings took place online because we were at the start of COVID, and it's actually turned out to be really beneficial for us. I would not have been able to be part of this project otherwise. I'm a wheelchair user and I have a carer, and traveling would just not be an option for me. And it also means you can be a lot more geographically diverse doing it that way as well. So that's always really useful to get different views, especially on health, different health boards, different areas. Because of our health conditions, we had various issues that might not be issues in other areas of PPI, that people with chronic pain need more breaks than sort of your regular Zoom meeting, if you like an office Zoom meeting, because we might need to move around more, we might need to take medication, things like that. So that was all incorporated, and we were given the option of having our cameras off if we wanted to, if we were more comfortable, because if you have chronic pain, sometimes something like getting dressed can be really difficult. So it gave you the option to be in like lounge clothes, which was really useful. Communication, because we were all lay people and a lot of us didn't have experience in research, we were all given training and everything was explained at a lay level from the ground up. So they really built up our knowledge so that everyone was on the same level and able to take part fully in the project and have the most useful information come from us because we were all informed. Being heard can be quite a difficult thing when you have a health condition. You can often feel like you're not heard by doctors, professionals, other people. And something that really helped that was the ground rules, which May showed you. The ground rules really helped us all sort of come together as a team and make sure that everyone was comfortable with everything, like not sharing any of the information that we talked about in the meetings with other people, and respecting everyone's views, which is a fairly standard thing to include, but sometimes people have very different experiences and quite strongly opposing views, so it's always a really useful one to have.
And here's just showing you how we really included PPI not only in our late dissemination strategy for the communities, but also on the scientific outputs we had planned. So this is the NIHR report. We have a whole chapter just about PPI explaining all of those things that we talked about today. So if you want more detail, you can find it there. And PPI, they were amazing, really taking the time to work with us and create this chapter together. And they've kindly let us add some feedback to it, so their experiences on the project. So you can see there is a lot to read. So I highlighted 2 sections that I think are really important, and it just speaks back to what Georgina just said. So one of them is, well, Georgina, she was happy to be named as well. So she said that everything they said was listened to, noted down, discussed, which made them feel like make her feel that their opinions were valued. And then another feedback we had from one of the moms from the group, saying that working in Champion with caring medical professionals and understanding researchers as well as others with similar experiences felt really validating. And for once, she felt she was heard, she was believed and accepted. So it just shows, again, people with chronic conditions like Georgina said, they can feel a lot like they're not listened to, and giving them this space and this voice to get their experiences across and make something with it that will benefit others. So I think that's a real power of patient public involvement.
So there are loads of benefits to using PPI in research, but there's also a lot of benefits to us as patients and the public. As you can see here, there's some examples of them. I mean, something positive coming from our conditions is wonderful, because often things can be quite negative. We can talk to doctors about how much we're struggling with things and things like that, but having something like this happen and getting to help others as well is just a great feeling. And getting paid work as well can be really difficult with health conditions, because you can really vary with sort of how well you're doing even from day to day. So PPI enables us to not only have an income but also contribute to meaningful work.
Brilliant. So that's pretty much it for that example of the case study. So thank you so much, May and Georgina, for talking us through that and your experiences being on that project. Just to kind of begin to wrap up this session then, so we have a little bit of time for any questions or discussion. Hopefully some of the same themes have been coming through from the overviews I was giving to that real life case study just then. If not, they're on screen. So one of the most important things is about involving people to work with them. And that was that sort of spectrum of participation we were looking at earlier, where people don't feel like research is being done to them or even for them in a kind of paternalistic way. It's working in equal partnership. That means if you are going to work in partnership, as Georgina was highlighting, you need to be flexible, inclusive about the way you work, be sincere, be authentic in how you approach the partnership working, and actually treat them as experts in their own experience and people who can bring something to your project. Something to think about in terms of, well, 2 things really in terms of timing. What are the kind of problems that you're trying to solve? So was it one of those simple issues? Is it a complex issue? Is co-production what you need? Do you need to actually start with a bit of education on something to actually enable people then to take part, to kind of skill them up? How can people help you address those issues? And then also, just to underline that point again, it is never too early to start talking to people about what you want to do. Giving them the opportunity to shape the idea, feel involved, feel like they've got a stake in it is so much more powerful than approaching people once you've really cooked something up and got some money to do it, but it's too late to make any changes. So yeah, earlier the better. And again, if anything's come through from this, then be clear about what you're intending to do. So like, how do your plans match up with those UK standards of public involvement? And then record what you're doing, record who you've spoken to, what they've said, what sort of impact has it had. And something that we don't always have a lot of time to do, but it's really important to make time for us to reflect on it. So something that's quite powerful is also to like reflect on, what are your maybe perceptions going into this? What might some of your biases might be? What do you think you're hoping to get out of it? And then to actually think about maybe with the people you worked with, okay, did this lead us where we thought it would be? Did we feel like we got to do what we wanted to do? So yeah, a really good thing to do. So could you go to the next slide, please, May? Magic. So if you enjoyed this kind of quick whistle stop tour, then shameless plug, May, myself and another colleague, Michaela, are doing a 2-day course that's about this, really going into more detail about the principles, some of the themes around involvement and engagement in research, talking through some of the tools that you can use, some of the I guess the theory that you can apply to it, and also doing some more work with public contributors as well. So that's in late February next year. You can book onto that through Data Science Open Learning, which the website is on screen, but we can share that after if anybody's keen. And yeah, just a really good platform. So hopefully you can join us there. And yeah, I think if you skip to the last slide, May, that's just our contact details as well. So if there's anything you wanted to ask myself, May, or Georgina about, whether that's with some of the tools, the overviews, the principles, or about the Champion project in particular, then please feel free to get in touch with us. So that's it for the presentation part of this. I know we've got just under 10 minutes left. If anybody does have any questions, then yeah, feel free.
Thanks very much. I think that was really fantastic in that you can do co-production with things like or a systematic review, which most people would think that's pure academia. You can't really do co-production with that. So I think that to show that you can do that, you can actually use co-production in anything, any form of research, I think is really excellent. From my point of view, I think one of the problems for co-production is the setup before you have any funding. It's very hard to then offer people any paid work, really, if you don't actually have the research funded. And so one of the benefits, I think, of HDR UK is there is a co-production team funded now to help people with that. So hopefully that makes it easier. Having you, Jack, and other members of the team like May and Michaela and that, to be able to involve people before the research funding. And there's also the setup, I think, which is very difficult, having people in place. It takes quite a long time to find people who are relevant to the research you're doing. So I don't know if you want to comment on that, and then maybe Matthew, if you have a question, maybe go ahead. So go ahead with your question, and maybe the team can comment on both.
Yeah, sure. Thanks. Thanks everyone for the presentation. It was really interesting and really excellent example of public involvement. I guess my question was, particularly around sort of training for public contributors, when it comes to things like data health, data science. There's a lot of sort of technical terminology and techniques used that can be quite complex, even for the researchers doing it. It can be difficult to grasp at times. So I wonder how you strike a balance between giving people training so that they can engage in the research and the concepts, but at the same time not kind of turning them into like proto quantitative researchers. I think it's something I'm thinking about at the moment, and I'm finding it quite difficult. Like, how far do you go with the training? Yeah.
So what we've done is really leave it up to them, and we're trying to be quite flexible. My first instinct would always to think, what do you need to ask them? What kind of input do you want from them? So be quite goal orientated, and then try to remove the jargon if you can, as much as you can, and just bring to them that clear, what kind of action do you need? What kind of questions you want from that data? But sometimes, like when we did a survey, they wanted to know what was the meta-ethnography. They wanted to know all of those things. So we did explain, but during our activities, normally involvement activities, we would not use any jargon. We'll try just to get to the core of what is it that I want to ask them. What do I need from this data? Because we're also working with data, even though in the studies was mostly qualitative data. And then just bring those questions to them. So you need to be able to question your data set first, get all of those questions, and then create scenarios if you need, like we've done with the cartoons, and then bring that to your members of the public. I don't know, Georgina, Jack, if you want to add anything else.
Probably just say, like, my background isn't in data science, and I'm basically a layperson coming to this. I've done public involvement, but I've not done this kind of research or anything like that. So I've helped out a few times now with plain English summaries of people's research proposals, and quite often I find myself thinking, or at least then saying, is do I need to understand exactly how all of these things work together, or do I just need to know what it does, what the outcome is from it? And maybe breaking that down as much as possible to be like, okay, well, is this, depending on what your research is, but depending on like a process, it's like, do I need to know just what the things are that go into it and what that can enable us to do, or do I need to know the different bits of the process? So maybe just thinking like, how far can it be simplified for me to get the significance of it without needing to know all of the gubbins which kind of make it up? But and that's a conversation that you're going to have with the people that you might be working with. Really, it's hard to guess people's thoughts, which I guess is what May was saying, is you need to just see where people's understanding is at.
Sure, thanks.
And I just want to give an example. Sorry, I know a few groups, they even offer internship to the young members of the public in case they want to build up to, develop the research skills in the future. So that's a possibility. Again, it's a two-way relationship. You're gaining with their experiences and lived experiences, and they're gaining with you because they're learning about research. So we need to see it as a both-way relationship, really.
So go ahead, Tracy. Go ahead.
Thank you so much, and I just want to say to May and Georgina, thank you very much for a really lovely presentation, and also it was really nice to hear about the really meaningful work that you did. It's really great. It's just on Matthew's comment. I think the learning for patient and public members is so important. We have a patient and public involvement member, and he's actually been with us a long time. He's a lead on our project, one of our projects, and he was so keen that we developed some training in statistics, because he said otherwise it's really quite tokenistic to have public members sitting in meetings and researchers are using terms and talking about things that people just don't understand. And I think there's a real difference between someone having maybe a glossary or, an hour's training session, and doing a 3-year degree in statistics. It's not so much about them having too much knowledge, which I don't see why people are frightened about that, but it's about making sure that they have enough knowledge that they feel comfortable to make an informed decision and opinion on the research and the process. That's just my 2 cents on that.
Thank you. Thanks. Does anybody have any other questions or thoughts at all? So I just want to highlight that the next webinar is in February on Thursday the 6th, and it's looking at natural experiment evaluations using health and administrative data together. And that will be looking at an evaluation that's looking at violence and the prevention of violence through A&E. So thanks very much to everybody for presenting today, and thanks for everybody for coming. And hopefully see you in February. And if I don't hear from you or see you before, have a very good Christmas and a very good break. And see you soon. Bye.
Thanks very much.
Bye. Thank you, everyone.
Bye-bye.